a neonatal transport nurse from ScotSTAR Neonatal Transport Team. You're probably watching this video because you've been told your baby needs to move to another hospital. Now this can be because they need a different level of care, or you might be lucky enough to be getting your baby moved closer to home. Whatever the reason, we know that this can be a really scary time for you and you may have lots of questions. So in this video, what we're hoping to do is give you a little bit of reassurance, answer some questions that you may have, and show you what's involved in the transport of a baby. If you have anything else that you would like to know, please speak to the nurse looking after your baby, or if you see us about, stop us and ask us a question. We're always really happy to help you. We're made up of specialist nurses, all of whom are expert in intensive care of neonates. And we also have advanced neonatal nurse practitioners and doctors who are experts in neonatal intensive care. And we also have our drivers who are expert at getting babies around the country in a way that is comfortable and safe.
We travel in a specialist vehicle, and occasionally, depending on distance, we may need to use a plane or helicopter to move your baby. We have 3 different intensive care transport incubators. They can look a bit intimidating because of their size and all the equipment on them, but they are able to provide all the same support and do the same job as the equipment in the neonatal unit. This doesn't mean that it will all be required for your baby, but it's there if we need it. This is the incubator. It's designed to keep your baby nice and warm throughout the journey. Inside is a nest. This is to keep your baby secure and acts as a seatbelt for your baby. This is the ventilator. It is able to provide breathing support to your baby if required. This monitor displays baby's observations throughout the whole journey in big numbers so that they're easy for us to see throughout the trip. Our equipment has a number of alarms that may sound. Most often, these are nothing to worry about, and the staff travelling with your baby will respond to these as required. These are the pumps which enable us to deliver fluids and medications to your baby. We also have equipment bags which contain equipment used in a neonatal unit, should we need any of this before or during the journey. We have a cool bag, and we're able to take some cooled milk if you have any for your baby. We do have limited space in the ambulance and plane, so if you have lots and lots of milk, we may ask that you take this yourself to the next neonatal unit. This is our twin kit. Depending on the availability of this and the nature of the transfer of your babies, we may be able to transfer 2 of your babies at the same time. Unfortunately, whilst we will always try to minimise separation of twins and triplets, this isn't always possible, and it's sometimes necessary to transport them separately. When moving babies closer to home, we will always try to move siblings the same day to minimise separation of families. Very occasionally, due to emergency transfers, this isn't possible. The local team caring for your baby should make you aware of the plan for their transfer. Whilst we will always try to give as much notice as possible of when we will arrive, our teams cover the whole of Scotland. This does unfortunately mean that sometimes plans do have to change last minute. If this does happen, we will keep you and your local team informed. When we arrive, we will introduce ourselves and give you the opportunity to ask us any questions that you may have. We will make sure that you know why your baby is being transferred. Then, we will receive a handover from the local team who will tell us all about your baby and what has happened so far. We will ask questions to make sure we have all the information, and we will be given a copy of your baby's discharge letter. We may take some time to look at your baby's blood test results or at their x-rays. This makes sure that we have all the information to pass on to the team who will be receiving your baby. We will then examine your baby, take some observations, and if required, give them any treatment that they may need to make them comfortable, calm, and safe when we travel. We will take our time to carefully prepare your baby for transfer and move them over into our incubator. We may also spend some time preparing medications that we anticipate might be needed during the journey. Once everything is ready, we will carefully move your baby from their neonatal incubator over into the transport incubator. This incubator allows us to observe your baby closely at all times. Once your baby is moved into our transport incubator, we will again check your baby along with all of our equipment. We are fully equipped with everything that might be required for the journey. We will try our very best to give you a chance to have a cuddle with and take photos with your baby before they are moved into the transport incubator. though unfortunately sometimes, depending on the reason for transfer, this isn't always possible. Before we leave, we will perform a safety checklist. This is to make sure that we have all of the information we need about your baby and all of the equipment is ready to go. In most cases, we can have one parent travel with us, and we do all we can to accommodate this. However, there are some situations where this is not possible. Unfortunately, if a mother has not been medically discharged from the ward and is fit and well, she will not be able to travel with us. This is because we are a team specialised at looking after babies, and your baby will be our focus. If we had to call a 999 ambulance for an unwell mother, then this would delay the transfer of your baby. Another situation where it is not always possible to take a parent is when we are travelling by air. When a mother is unable to travel or does not wish to travel with her baby, we will offer the option of another parent or a person of your choice to travel with your baby. The team will discuss this with you and explain any reasoning if this is not possible. Not all parents wish to travel in the ambulance, and that is perfectly okay too. If a mother is still an inpatient, then the hospital will try to arrange transfer of her separately to the same hospital as your baby. Before we leave, we will make sure we have your contact numbers and that you have a phone number of the neonatal unit we are travelling to. We will also show you where you can access information about the neonatal unit that your baby is being transferred to. When we get to the ambulance, we will load the incubator containing your baby into the back of the ambulance. It takes a bit of time to make sure all the equipment is fitted in correctly and that your baby is okay and settled before we set off. If you're travelling with your baby, we will show you where to sit. You will be required to wear a seatbelt throughout the journey, and you may have to sit in a backward facing seat. Do let us know if you suffer from travel sickness. Once everyone is sat down with seatbelts on, we then confirm with our driver that we are ready to go and where we are going. We will make a call to the unit we are travelling to let them know that we are on our way and what our estimated time of arrival is. This makes sure that they are expecting us and ready for our arrival with your baby. The transport team will care for your baby throughout the journey as they would on the neonatal unit. They will respond to any alarms and attend to your baby as required. Occasionally, the team may ask the ambulance to stop to enable them to do this. If this happens, please follow their instructions. Our aim is to get your baby from A to B as safely and as smoothly as possible. Sometimes, depending on your baby's condition, we will use our blue lights and sirens. In some cases, the transfer of your baby will require part of the journey to be by plane or by helicopter. In this situation, the incubator is moved over to fit into the plane or the helicopter. If a flight is required, then we will also have a flight paramedic on board with us. There will be an ambulance waiting when we land for us to move your baby into and to travel to the hospital. The seats and weight limit are limited when we fly, and so this might mean that unfortunately you are unable to travel with your baby. Sometimes other factors such as weather, length of runway, and weight can affect the number of people able to travel. We are guided by our pilot colleagues on this, and whilst we will always advocate for space for a parent, our main priority is to get your baby to the next hospital safely. When we arrive at our destination, we will carefully unload your baby in the incubator and make our way to the neonatal unit. Once there, we will plug in our incubator and equipment and then hand over to the local team who will be taking over the care of your baby. We want to make sure that they have all the information about your baby, and we will also give you the chance to add any information that you think is important. We will then slowly move your baby and equipment over from our transport incubator to the unit equipment and incubator. If you've not travelled with your baby, then we will call you at this point to let you know we have arrived. We really hope this video has helped prepare you as best as you can be for the transfer of your baby. We understand this is a very difficult time and we're here to answer any questions that you may have.